Hi everyone! In this video, we will be going over ideas for pre-work assignments and how to go about including study resources for your learning sessions. Pre-work can be anything you want to assign residents to help them prepare for active learning and discussions during your session. Planning your learning session in pre-work should begin with devising 3 to 5 clear learning objectives to serve as a framework for residents to focus their studying on. If we look at glaucoma, for example, this is on their curriculum roadmap and what you might want to send out to residents prior to your learning session. We have here a nice display of their learning objectives, as well as the expectations of pre-work and what materials residents should use to best prepare for their session. Pre-work assignments should take about 2 to 3 hours to complete and should be sent out to residents 1 to 2 weeks in advance so that they have adequate time to prepare for the session and better budget time management for reading ahead. In terms of the assignments themselves, a great place to start is BCSC, of course, in assigning the correct corresponding chapters or sections of chapters pertinent to your session. Another great place to start is Moran Core in assigning residents to watch a previously recorded lecture. We have at least the past 1 to 2 years of didactic lectures recorded and archived on the Moran Core website. So if you go to Moran Core and click here on Resident Lectures, all the subspecialties and divisions should have a nice list of their previously recorded didactic lectures. So for example, neuroophthalmology has a neuroimaging lecture that is typically given by Dr. Davidson of the neuroradiology department each year. However, for the last couple of years, we've been watching his 2018 lecture ahead of time and then using in-person lecture time for an interactive quiz session of mix and match anatomy, as well as multiple choice questions for anatomical cases. Other specialty lectures or grand rounds can be found on the side panel. Of course, journal articles and landmark trials are always great reading assignments. iWiki is another good resource with concise and digestible articles on disease topics. For Dr. La Rochelle's lecture on posterior uveitis, she had us pick 2 rare entities out of West Nile, Duzen, onchocerciasis, Lyme disease, and cysticercosis to read on iWiki. Residents then paired up during the session time to teach each other about the disease entities that they did not read on. This was an effective and quick mutual learning exercise that helped us learn rare topics that the BCSC text does not necessarily discuss in detail. Videos are great for visual learners, and some of the resources residents are most familiar with are gonioscopy.org from the University of Iowa. Here they have lectures on exam techniques as well as anatomy. Iowa also has a great collection of surgical videos from other subspecialties. Oculoplastics.info has surgical videos in a nice stepwise fashion from Dr. Richard Caesar. And of course, videos from our very own novel library can be a great way to learn exam findings and various neuro-ophthalmology topics like nystagmus. Podcasts like Eyes for Ears can cover a number of topics and have high-yield clinical scenarios. And some attendings have sent out PowerPoints as pre-work, either for residents to review didactic material ahead of time or to study clinical cases that will be discussed during lecture time. So for example, Dr. Kamansky had us review images for his diabetic retinopathy lecture 1 week before the interactive session and activities, and Dr. Degree had sent us a PowerPoint of clinical cases with an assignment to come up with differential diagnoses and next steps of management so that we would be prepared to discuss this during lecture time. Lastly, one way to make your learning session more interactive is to save the last 20 to 30 minutes to answer resident questions. As a part of your pre-work, you can have residents email you interesting cases, challenging patients they encountered in clinic or on call, and questions on imaging modalities or diagnostic studies as related to your teaching topic. So, one of the biggest concerns from faculty that was voiced in the survey we distributed in the fall was how residents would be held accountable for pre-work. We've suggested that each learning session begin with a 10 to 15-minute quiz on the pre-work material. By having learners participate in oral board-style questions, team-based learning exercises, and group discussions, residents will be motivated to prepare for these interactive learning sessions, and it will hopefully be apparent that they will get much more out of these sessions if they come ready to apply their pre-work knowledge. So, some takeaways from this video on pre-work are to come up with 3 to 5 clear learning objectives for each session, and that assignments should take about 2 to 3 hours to complete and should be distributed to residents 1 to 2 weeks ahead of time. And as always, if you have any questions, please reach out to your MOL faculty liaison or resident champion. we'll be posting a document on pre-work examples on this Central Learning Experience webpage so that it will be easy for everybody to refer back to. So thanks everyone. Hope that you found this helpful.